21 million people living in the U.S. are recovering from substance abuse. In addition to suicide prevention, September is also National Recovery Month. Tiffany Bittner and Geoffrey Ball with the Harris Center are here to talk more about the correlation between the two. Good morning to you both.
Good morning.
Thank you so much for continuing this conversation.
Absolutely.
One we started at the beginning of the month, one we're continuing right here today. Talk to us about that connection between the two.
Sure. There's a lot of studies out there that show substance use directly correlates to suicidal ideations. There's a significant increase in suicide attempts. Those that have substance abuses, there's reports that 40% of people with a substance use disorder have attempted suicide in their life, and that's a significant number. Substances alter our brains, and so we do things that maybe we wouldn't do if we didn't have those substances in our body. So they definitely go hand in hand. Most time people start using substances to cope with something going on in their life. And so there's already those emotions there, and then you put on top of it a substance that kind of takes away your inhibitions and things like that.
The good news is we have resources to address both. My question to you this morning, can this complicate addressing the issues, knowing that there is a layer of substance abuse going on?
It can always complicate it, because when someone is actually using substances, that de-inhibits their way of thinking, right? So if it does that, to make those numbers Tiffany was talking about more realistic, we have at least 22% of people that drink alcohol, they commit suicide. 20% of the people that use opioids, be it painkillers, be it heroin, it's 22%, and they are committing suicide. So suicide is the number one killer for people who actually use substances.
Talking about these numbers, it's not to scare anyone, it's just the reality of the situation. And talking about these types of issues, will hopefully lead to saving additional lives. Talk to us about intervention. We know early intervention is crucial. It's critical in making a difference in people's lives. Talk to us about ways you can do that.
Sure. At the Harris Center, we've talked last time I was here, and we've talked before about we're always going to screen our individuals coming in for services for suicidal ideation. Those conversations about substance use and substances that are, how often they're used, those conversations are started in those mental health appointments as well, so that we can see if there's a correlation, so we can see if there is something there. Early intervention is key because you want to get to people before that addiction gets too far. Addiction's a disease. And the reality is, once you get to a certain point, it's hard. It's hard to fight through, and the treatment is long. And so we want to be able to get to people prior to getting to that point, so that we can really start to help them develop better coping mechanisms other than a substance. And so we'll start those screenings early. We'll start talking to people early. We have outpatient therapies and groups, and then Geoffrey's team and a couple other teams have a lot of different partnerships for medication-assisted treatment and things like that.
And that's all part of this integrated care.
Yes, we believe in really tackling it simultaneously, because once someone actually starts diving down that rabbit hole, we're talking about anxiety, depression, all these behavioral health, mental health disabilities that they have already gets increased with the substance use.
What's your message this morning to folks struggling with one or the other, or perhaps both?
You're not alone. It's okay. It's not something to be ashamed of. We're here to help you at the Harris Center. That's what we do. That's our passion. We recognize that all of us have our own battles, and we all have those times in our lives. And so we want the community to understand that it's okay to not be okay. It's okay to need to reach out and ask those questions and get that help. And I think the other thing is to those who aren't struggling with addiction or aren't struggling with suicidal ideations or other mental health concerns, be kind, like we talked about last time, and be open to having that conversation, and be open to helping those around you get the help they need and supporting them through the start and the long haul of their recovery journey, because it's a long-term thing.
It's recovery.
Yeah, and if it's not you today, it could be you tomorrow, and if it's not someone you know today, it could be someone you know tomorrow.
For sure.
And so being kind and being empathetic and bringing that understanding can go certainly a long way.
Absolutely.
For more information, for resources, for help, where can folks go?
So then go to our website at theharriscenter.org. Also, obviously, like we've talked about before, 988, anytime there's a crisis, that's the National Suicide Crisis Line. We answer that here in Harris County. We answer it at the Harris Center.
24/7?
24/7,
365.
365. We also have the Harris Center Crisis Line, which is 713-970-7000. That is also answered 24 hours a day, 7 days a week. You can get resources from there. We can get you plugged into appointments. Geoffrey's team goes out in the field, and you can find them out in the community as well, and just ping one of them and ask them, hey, we need some help today, and we'll get you in there.
No silly questions?
Never.
If you're struggling, reach out.
That's right.
Yeah.
Reach out to SUDOP as well, SUDOP Substance Use Disorder Outreach Program, 713-970-7441.
Okay, I know we threw a lot of information at you. We're going to put all of this information on our website, clicktohouston.com. Geoffrey, Tiffany, thank you so much.
Thank you so much for
coming
having
in.
us.